Hearing loss is a very complex topic, but luckily for step 1, you really only have to understand it on a very basic level. The most important thing that you probably need to understand is the difference between conductive and sensory neural hearing loss based on simple tuning fork tests. Let's first look at the Rene test. And what this test does is basically compare the sound that you hear when a vibrating tuning fork is placed on the mastoid bone to the sound you hear when that same tuning fork is placed outside of the auricle. If this latter sound here is louder than here, then ear conduction is greater than bone conduction and you have a normal result. Right? It makes sense that you should be able to hear the tuning fork better through your ear, as that is the system designed to take sound and transfer it into the information the brain can use than through the mastoid bone. However, if bone conduction, when you place the tuning fork here, is louder than when you place the tuning fork here outside the ear, then bone conduction is greater than ear conduction, and that is abnormal, and the patient may have a conductive hearing loss. And this makes sense. If you have something that is blocking the ear canal, then the cochlear is insulated from this sound. The sound waves coming from vibration of the mastoid will have a greater effect on cochlear vibration than sound coming through the ear canal. The second test that you can have is the Weber test. And this involves placing the end of the vibrating tuning fork in the middle of the patient's forehead. So let's draw a patient. This is a really ugly patient, but whatever. There's 2 ears. I have no idea why I'm spending this much time drawing a nice patient for you guys, but we'll work with it. Okay, so for the Weber test, it involves placing the end of the vibrating tuning fork in the middle of the patient's forehead. So our tuning fork is going to go there. Normally, you should hear the sound equally on both sides, although many people will say they can't hear anything at all. Now, if you put your finger in your ear, you will hear the tuning fork only on that side. This simulates a conductive hearing loss. The Weber test lateralizes to the affected side in conductive loss, while in sensory neural hearing loss, since the nerve does not work, it sounds louder on the unaffected side, which has a normal nerve. Sensory neural hearing loss occurs naturally as part of the aging process, and this is known as presbycusis. You do a Rene test and deduce that a patient has conductive hearing loss in her right ear. The Weber test will localize to which ear? The right ear. In conductive hearing loss, the Weber test localizes to the affected ear. Now, one really good way to remember this concept is to hum. Go ahead and do it. Okay, now put your finger in your right ear and hum again. You've just essentially created a conductive hearing loss in your right ear and will hear the hum louder on that side.